This is how the New York Times thinks awareness of men's health should be raised. Neon titty bar signs about beer, wings, sports, and color TV. In the United States, I could find 19 hospitals dedicated to women and 0 for men, and 27 preventive services for women with only 1 for men. Just like the exposure I did with revealing the education industry scam on men, this is the same theme in a different industry. In this series, I'm breaking it down. Men die younger, how healthcare ignores them, and what it would take for things to finally change. In part 1, we start with last week's New York Times story about one of the only men's health centers in America and what the article reveals about why men live 5 years less than women. The article was a feature on the Cutler Center for Men in Cleveland. It's one of the few clinics in the country that's intentionally bringing men into the healthcare system. The article's message is simple and unoriginal, but unsettling nonetheless. Men in the United States live 5 years less than women, in part because they avoid doctors, but also because the system itself gives them fewer entry points and less structural support. The author of the article argues that without cultural change and institutional involvement, men will keep showing up only when it's too late and after their damage is already done. So it's no surprise that men in the U.S. live an average of 5.3 years less than women. And that gap widened dramatically during COVID pandemic when men died nearly 60% higher rates, often because of unintended pre-existing conditions. Men die from 14 of the top 15 leading causes of death, and often years earlier than women. And I argue that the reasons are far more than the health industry admits about culture, the healthcare industry, and why institutions quietly devalue men's health. The Times article highlights that what doctors see every day, including that men don't show up into the doctor's office until it's too late. According to reports, men often start to avoid the doctor's office in adolescence and then reappear years later in emergency rooms with advanced cancers, heart attacks, strokes, and usually after their wives or their daughters dragged them there. According to reports, women drive 80% of medical decisions in households and are nearly twice as likely to have had a checkup in the past year. Men, on the other hand, often take pride in saying, "I haven't seen a doctor in years." And that pride is the cultural script of precarious manhood. It's the belief that being a man includes expressing toughness through denial. But culture does not live or operate in a vacuum. The system reinforces men's absence from health care. As an example, the Affordable Health Care Act guarantees 27 preventive services for women, but only 1 for men. As an example, breast cancer screening is built on established and clear recommendations, such as starting regular mammograms at age 40, while prostate cancer screening is vague and far less discussed. There's an entire cultural movement built around pink ribbons and early detection for women. Hell, Inter Miami's arena, just down the street from me, named their entire stadium after women's health. Who even knows the color of ribbon for prostate cancer? And when the media covers men's health at all, it does so with mockery. Look at these neon sign images again from the Times that they ran right alongside their article. Prostate exams, wings, beer, color television, music, good food. The message that the Times sends is that to get men into healthcare, you need to market medical clinics like titty bars. Imagine if an article on breast cancer came with images of Chippendales, cats, and boxed wine. People would lose their fucking minds. Healthcare institutions rarely come out and say, men's health is less important, but their structures say it for them. Just like I explained in my university accreditation battle video a few weeks ago. The official claim is that the system is neutral toward men. Yet public visibility makes clear those concerns whose get attended and those whose do not. My contention is that men don't avoid doctors just out of laziness or out of pride. They absorb a constant signal that the healthcare system and facilities within it are not built for them. No hospitals in their name, no offices in Washington advocating for them, no pathways designed around their care. So when a man finally considers stepping into the healthcare system, he's treated like a guy who needs free chicken wings to make that choice. According to the Times article, the Cutler Center for Men in Cleveland is attempting to help men by easing their entry into healthcare. With pool tables, flat screen TVs, and staff navigators who handle logistics and nudge men toward colonoscopies or follow-up visits. Apparently this facility is helping because Cutler is actively attempting to attract men. And apparently when the system does go after men like that, men actually show up. As reported in the Times article, at Cutler, men are 40% more likely to keep appointments and 35% more likely to keep their diabetes under control. Now that should not be remarkable, but it is, because almost nowhere else in the United States has even tried to build designated facilities or networks for men, and that's a problem. Men should not need pool tables and flat screen TVs to be tricked into care. They need dedicated facilities, full services, and national advocacy, not bullshit gimmicks. This is the problem that we need to face head on. Men die younger, not just because of their choices, but because of the options available to them. In part 2, I'll break down the details in the numbers. Hospitals and medical centers built explicitly for women versus those for men. And then in part 3, I'll discuss the consequences. Higher death rates, the loss of fathers and husbands, and a culture that treats men's access to care as optional until it's too late.